Have you ever squinted at a road sign or menu and thought, wait, is my vision getting worse? Or maybe you've noticed frequent headaches or eye strain after staring at the screens all day. If so, it might be time for an eye exam. Maintaining good eye health is crucial, but many of us put off those routine eye checkups for far too long. Welcome to today's video. I'm Dr. Aisha Butt. Thanks for tuning in to our channel. In today's video, we're going into the world of eye tests and eye exams, from basic vision screening to comprehensive eye examination. We'll explore the different types of eye tests available and why they're so important for your overall eye health and vision. So what are some of the basic types of eye exams? Eye exams can be split into two main details. One that is comprehensive, just a vision check, making sure that your eyes are healthy, you're seeing your best, and the retina and back of the eye looks good. The other type of eye exam is very problem focused. We call it medical eye exams. Those can be two types as well. You can say that you have something in the eye, or you got scratch in your eye, paper cut, something is bothering your eye, you have dry eyes, watery eyes, or you have something growing on your eyelid, maybe some suspicious cancerous growth, or you were at a beach and you've got a piece of sand in your eye. Those are all medical problem-based eye exams. Let's say a patient comes in and say, I got diagnosed with diabetes and my endocrinologist said that you need a detailed retina eye exam and you need to get your eyes dilated. That is a problem-focused medical eye exam. We're focusing on the fact that your retina is intact, your blood sugars are not as high to actually cause bleeding or swelling in the back of the eye. Now remember, diabetes is the leading cause of blindness in the world for ages below 55. For ages above 55, it is macular degeneration, which is genetic. So if your grandparents or parents had macular degeneration, it slowly leads to blindness. How do we detect macular degeneration? In the comprehensive eye exams. So those are the two main parts of eye exams: routine checkups to find out if everything is okay with your eyes, and problem-based eye exams to make sure that we take care of the complaint that you come in. We call it a chief complaint. Whether it is dry eyes or bleeding in the back of the eye due to diabetes or macular degeneration, we do the testing based on what the problem is. Some of the other eye exams can include pediatric eye exams, where we're making sure that we're talking to parents about a child meeting their milestones, making sure that they were full term and the health is okay and the eye is growing the way it should. It is called emmetropization. It is a fancier way of saying that the eye is growing the way it should be. As the child gets older, they need to come in for routine eye exams. Now remember, we're not asking them which one is better, one or two. We're using more of like objective eye exam methods. For example, showing them some toys, moving objects in front of their eyes, making sure their two eyes are aligned with the help of some special lights. Retinoscopy, special lighting that is used to make sure that their eye prescription is where it needs to be. We want to make sure their eye health is not too long. If the eye health is too long, they could be developing early myopia. Remember, if two parents are myopic or nearsighted and they need glasses to see far away, even if they had LASIK done, their child is at a high risk of developing myopia. Now remember, kids don't complain. They have only seen the world with their eyes. If things are clear to you, please don't assume that your kids are seeing as clear as you are as well. So make sure you bring them in for a comprehensive eye exam as early as 6 months of age. Another type of eye exam that I'm really passionate about is contact lens evaluation or contact lens related eye exam. Now, all comprehensive eye exams by default will give you a pair of glasses prescription. You can get a pair of glasses if it's a small prescription. If you don't need it, we'll tell you to come in next year. However, some patients want to wear contact lenses. Some contact lenses can help us control myopia. As early as 6 or 7-year-old children can wear contact lenses. Contact lenses can be soft or hard or difficult to fit. Hard contact lenses are really important to get you that crisp, solid vision. Some patients have special eye conditions like transplants or keratoconus, or they may have scars in their eye that prevents them from actually using soft contact lenses, or glasses just don't work for these patients. Those patients need medically necessary contact lenses. So why is early detection important? Why do you need to come in for a routine eye exam when there is no problem? Sometimes comprehensive eye exams can detect conditions that are not affecting your vision quite yet. However, treating them or detecting them early on can actually preserve your eyesight. For example, early detection of glaucoma, macular degeneration, cataracts, and such conditions can be treated early on in your life. Macular degeneration especially, we need to make sure that patients are taking care of their eyes and they are taking a healthy diet and nutrients to make sure that their macular degeneration does not progress. We put patients on lutein and zeaxanthin. Those are special nutrients as part of their multivitamins that they need to take to prevent the progression of macular degeneration. I personally let my patients go home with Amsler Grade, which literally is a piece of paper with boxes on it. And that way, patients can do this very high-tech test in the comfort of their house. Any changes on those boxes can tell me if there is swelling in the back of the eye. I explain the eye as it's a camera. We have a lens and we have a film. And the lens focuses light on the film. Things can happen in the lens, such as cataracts. Cataracts is just over time yellowing or thickening of that lens, making your vision blurrier over time. Early detection of cataracts can help us so we can get the cataract surgery done and you preserve your vision. Same thing with glaucoma. Early detection of glaucoma is so important. If the pressures are high, we can put our patients on eye drops, lower your pressures, get some small surgeries done early on so the optic nerve does not damage. The sooner we detect that, the better it is. I believe in prevention. So for me, taking a scan of the optic nerve and monitoring its progression for next 5 to 10 years is actually more important and helpful. I would like my patients to have that test done every year. So in next 3 to 5 years, I can do what we call a formal progression analysis test. Same thing for foreign body sensation or dry eyes. If you wait till your glands are blocked up or your eye is so dry that now it's affecting your vision and you're getting frequent infections, that's a little bit too late. I tend to diagnose my patients for dry eyes early on so I can take preventative measures and we can prescribe some over-the-counter or prescription medications for these patients. Same thing with growths or funky kind of cancerous, growths growing on the lids. The earlier you can get it, the easier it is for us to remove that and send in for biopsy. You don't want to wait till that thing is bigger than your eye. One important aspect that I would like to share with you is that when it comes to eyes, patients can get a little anxious or scared. I have patients who don't want to come in for eye exam just because how scared they are of someone else touching their eye, or just the fact knowing or being informed that they have loss of vision or they have a disease that can lead to loss of vision. Well, if you're anxious or scared, please let me tell you, the eye exams are very easy. Look, we're the cool doctors. We don't use any needles. We don't have anything that hurts you. If anything, the worst thing we can do to you is use some eye drops to dilate you and torture you with some of the bright lights, which over time you can get used to as well. Most of our testing and our photos are very quick. Within a matter of seconds, we can take pictures of the retina and share and detect and diagnose what's going on. When it comes to anxiety, it is very important that you're communicating with how you feel with the doctors. If something is not right or you're not feeling comfortable, your heartbeat is going up, share that with your doctor. So you have scheduled an eye exam and you're wondering, what would it include? What am I going to do? Do I need to prepare for this test? Not really. From the time you walk in, there is some paperwork, where you allow us to discuss the test results. There's HIPAA laws that we discuss and make sure that, everything is good. Then your vision is tested. We call it VA, visual acuity. We want to make sure that you're seeing the best, and we compare it with the average or normal acceptable VAs. We want to make sure you're able to drive at night and during the day. We also check the muscle alignment. If the muscles are not aligned, you may have strain, headaches, or even double vision. At TSO Briargrove and Champions, we make sure that we use top-of-the-line technology to detect the muscle misalignment. You put in a headset on your head, and we are actually detecting how your eyes are moving. That test is very crucial to find out if eye misalignment is causing headaches, neck pain, shoulder pain, or any kind of tension and strain in around your eyes. Once the muscle misalignment test is done, we would also check what kind of prescription you need in glasses or contact lenses for you to be able to see your best. If you don't need any correction, we move on to the next step in our eye exam, which is checking the health of the front of the eye. The front of the eye, called cornea. We also make sure that the lids and lashes are clear. This is how we detect Demodex or eye mites in the bottom of the eyelashes. Next comes the testing for dry eyes. I may use some green or yellow tears in the front of the eye to see if your eye can show me any signs of dryness, itching, burning, and things like that. At that spot, I may or may not flip your eyelid based on whether you wear contact lenses or not, because that's one way for me to detect if there are bumps or any kind of abnormal findings because of overwear of contact lenses. Next comes the back of the eye or retina exam. We put a couple of drops in your eyes, which will open up the brown part of the eye called iris, so that hole, the black circle in the middle of the eye, gets bigger. This is sometimes the most kind of, inconvenient process of the eye exam, but trust me, patients survive this, they live. What happens because of that is that now we're able to see the back of the eye or kind of midsection of the eye. We make sure that patients don't have any cataracts, okay? Cataracts can limit their vision while driving at night or even during the day. It can affect your near vision as well as far vision. If they have cataracts, we send them for a consultation for cataract surgery. We also check for the health of blood vessels. If patients have had stroke or heart disease, high blood pressure, that can actually be detected in the back of the eye. So even though it's part of the routine eye exam, we're checking for diabetes, high blood pressure, macular degeneration, and certain drug use. Drugs can also affect the health in the back of the eye. Inflammation, certain autoimmune diseases can affect the back of the eye. So while we're looking at the retina, we're looking at your whole body's health. And yes, that's why we call eyes are windows to your health. So what is so special about eye exams here at TSO? We use top-of-the-line technology. We pay attention to the detail. We spend time with our patients. So if a patient is anxious, we want to take time with those patients to make sure they're relaxed enough. For pediatric eye exams, we don't even wear our jackets to make sure that our kids are a little comfortable and they don't think that we are doctors. TSO has state-of-the-art technology to make sure that we are detecting all the diseases of your eye as early as we can. We also specialize in contact lenses, difficult to fit contact lenses for kids that can prevent them from getting worse in their myopia. So if you want to know the details and you want to find out why our eye exams are way more than a drive-through experience of a quick vision test by a nurse or at a location where they do not have all these medical technologies, give us a call. Throughout this video, we covered the essential world of eye test and eye exams. So if you have been putting off your next eye exam, it's time to take an action. Don't wait until you start experiencing vision problems. By then, it may be too late to prevent or slow down certain eye conditions. Regular eye exams are the key to catching issues early and protecting your precious eyesight. Take the first step today and schedule your comprehensive eye exam with a trusted vision doctor near you. Your future self will thank you for prioritizing your eye health and taking proactive steps to preserve your vision for years to come. If you like this content, don't forget to like, share, and subscribe to our channel for more informative videos on eye health and vision care. Until next time, thanks for watching.